Medical bills is the number one cause of debt and bankruptcy in the United States. Hello and welcome to Woman Power. My name is Lorna Grayling and today we're going to be talking about how to crush your medical bills. Joining us in studio is Dr. Virgie Bright. She is an internal medicine physician, an author and a radio host. Dr. Virgie, welcome and thank you so much for joining us today.
Lorna, thank you for having me. It's good talking with you.
This is a topic that everybody needs to hear. Absolutely right. This is like a fear for so many people.
It's a big problem in the States. The number one problem, frankly, in the States. You're absolutely right.
Yeah, I didn't realize that. You know, when I came, I immigrated from South Africa. It wasn't something that I dealt with over there. And coming here, just hearing people talk and the fear that they have of, having a medical emergency. It's super sad. So yeah, we're very grateful that you're joining us today. But before we go into that, because your book is literally helping a plethora of people, but taking a step back, I know you studied at Harvard and Michigan Medical School. Was going into the medical field and becoming a doctor always something that you have dreamed of, or how did you enter this profession? How did this come about for you?
Lorna, you're making me go way back. You're going to make me date myself. It's something that, came to me. So I grew up in the Detroit, Michigan area, which is what they call the Motor City. That's where the big three giant automakers from the States were all located. And in the late 70s, when I was a kid, I would hear about that's when all the waves of layoffs started. And my dad always listened to the news, we commuted into the city for my dad's work and to go to school and back. And I would always hear every morning, Lorna, I heard these stories, these news about, okay, today's the latest number of layoffs. Every day was like, how many is today? How many is this week? And all I could think of, as a little kid is, wow, what's going to happen to these people? They're going to starve. Like my brain was like, not like they could get another job or something. But in the meantime, what are they going to do? They had families. And Lorna, I thought, you know what? When I grow up, I'm going to do something that no matter what, people need me. So I thought, okay, well, that means that either people always, or other things that always happen to people, right? We either get sick and eventually, whether we get sick or not, we die. And I thought, okay, so either being a doctor or a mortician. I was like, there's no way I can be a mortician because people are crying all the time. That's just horrible. How can anybody do that job? I'm going to be a physician. And no matter what, even if there's I was thinking back to the stories I heard about the Great Depression, I thought, well, if there's no money, if nobody has money, at least people will pay me in pies. I swear to God, that was exactly what I was thinking. We'll operate for food, in my little brain, my little 9-year-old brain, right? I swear that's exactly what happened. And that was my plan.
So literally you have had this passion to help people from such a young age, because that was going to be my next question, because studying medicine is brutal, and you've literally gone from having this career to really being such an advocate and spending so much time on helping people. What brought this change about? Why this now?
So I went from decided I was going to be an internal medicine physician. I was working as a candy striper, another story as a kid. At that time, where I lived, you could not get a job without being the age of 16, or if you were younger than 16, your parents had to say, hey, you know, basically. So I asked my mom to lie for me so I could get a real job. And she's like, no, I'm not doing that. So all I could do, Lorna, was like volunteer as a candy striper, essentially. And the nearest nursing home needed volunteers. So I was volunteering for them. And one day I saw this guy walking in and out of these patients' rooms. He was by himself. He was wearing a long lab coat. And I figured, oh, that's the physician for the facility. And I thought, oh my gosh, that guy gets to talk to old people all day, every day. That's what I'm going to do. Now, again, I always say, no matter what my name is, I'm not the brightest bulb on the marquee. As a kid, I didn't recognize that there's a little bit more into being a physician than just talking to folks all day. That's when I ended up doing that. So fast forward, I ended up going into the issue is, taking care of our families, right? Women, at the end of the day, we're it. So I realized I was leaving my marriage. Fast forward, I needed to end my marriage and become head of household. So I needed a job with benefits. And I was like, you know what? I'm going to do something where I can work from home, a little bit of flexibility because I had young boys at the time, young kids at the time, and I wanted to have flexibility in terms of picking them from school and being around them, that kind of thing. So that's when I ended up in, long story short, in health insurance, US health insurance. And fast forward, I ended up leaving because of, again, medical issues. And I ended up was diagnosed essentially with breast cancer and had multiple surgeries. And one of the surgeries, Lorna, I ended up having a hospital roommate, and found out that she had been tricked into signing an agreement to pay a medical bill, a hospital bill that she didn't owe. And it's a true story. I tell the story all the time, Lorna. Literally, when I realized that she had been deliberately tricked, the curtain dropped. I saw red. I was so enraged because I knew it had been done deliberately. At this point, I'd been a physician, internal medicine physician for 25 years, a health insurance executive for a decade. And I thought, from the provider side as a physician and from the payer side as a health insurance executive, that I had a 360-degree view of how the US healthcare system worked.
Yeah.
Or so I thought, until I became a patient and saw what was being done deliberately to the folks in the US healthcare system, the patients, the consumers. And that's what I ended up doing what I do. When that happened, when I realized my hospital roommate had been tricked, Lorna, that's how Crush Medical Debt was born. I thought, you know what, Virgie, don't get angry. Get to getting, do something.
I love that. Yeah, that's the thing, right? Don't get angry, but get doing something. Oh, that's such a powerful statement right there.
Channeled it into doing something.
And it's such a sad thing to think of, because when you're in medical need, I mean, that is already really a scary place to be. And to have that place amplified by that fear of medical bills, and I realize that it's a huge fear among people. It causes huge anxiety. It causes people not to go to the doctor and not to research things when they come up in the beginning, and then it ends up being a much bigger problem because of that fear, right?
That's right. So through no fault of your own, most Americans, most folks live in the United States are just one accident or serious illness or diagnosis away from a lifetime of debt, or worse, bankruptcy, right? And I talk about that all the time. It's not your fault, right? Who signs up? No one's, we may sign up for student debt, but nobody signs up for getting sick or having an accident. And so through no fault of your own, the only crime you commit is by getting sick or injured in the United States. And it's the number one cause of debt, stress, and bankruptcy.
It's shocking. It is. It really is. I mean, I didn't realize, and now that I've read your book, and I'm so excited to talk about some of the things that people can do. And of course, we're not going to go into all of them, because they would have to go and buy this book. This is a phenomenal book to have, to really, I think everybody should have one in case, because, like you say, the one thing that we can be sure of is if you're alive, you are going to die at some stage, right? It's a scary thought, but
we're not going to go our whole lives and just be sick and problem free and accident or injury free and die in our beds peacefully at the age of 104, right? 104. Life doesn't work that way. It would be nice. It just doesn't.
It would be nice if it could, but it does. Not quite.
And the thing is, because none of us asked for this, I really try to make the information in the book accessible to everyone. You don't have to buy the book. That's why I do the radio show for free. Just because I want folks to have access to the information. I tell them, look, go to the website and get the resources, the information there. It can be, the high level stuff that I talk about in the book. You can learn actually from listening to the radio show and from going to the site and looking at the resources if you don't want to buy the book.
I love it. We'll have the link and the information on the radio show as well at the end, and the website and everywhere where they can find you. But yeah, a couple of things that people can look for in medical insurance. What advice would you have for them? And if they can't afford medical insurance, like what advice do you have?
Great question. So if you can't afford traditional health insurance in the United States, let's say that you don't no longer work for an employer, don't have a job through an employer who provides your health insurance, which is unfortunately the way that most of us in the United States get our health insurance. So let's say that you don't have a job that offers that, or you lose that job, or you're just in between, positions. What I tell people to do is two things, is to make sure, number one, that your primary care is taken care of. And number two, to make sure that you're protected with catastrophic insurance, what I call catastrophic medical insurance or disaster insurance. So number one, making sure you have access to your primary care. Now, if you have some resources, then you can look into finding a direct primary care practice or DPC. And what they do is in exchange for a monthly subscription or monthly membership, you have access to physicians for visits and televisits for health primary care. Like if you have a cough that won't go away, that kind of thing. Even if that's too much for you, if those resources are just so tight and you don't qualify for like Medicaid, which is state health insurance for those that can't afford it, then do this. There is what's called FQHC or federally qualified health centers throughout the United States. It's like a safety net. And what happens is all comers, they take all comers on a sliding scale. It doesn't matter what insurance you have or don't have. If you have nothing, you pay just basically on a fraction of whatever the formula is on your income. Okay, so what the FQHC encompasses is what people think of as community centers in the cities, and in rural areas, they're called or considered rural health clinics. So go online and I can give you the show notes. In the show notes, I can give you that link to a federally qualified health center near you. And they cover not just primary care, but they also cover dental services and mental health services. So that's the first thing you're going to do is make sure your primary health care is taken care of. And then you're going to look online for something that historically, traditionally United States, Lorna, is considered supplemental health insurance, because in the States, our health insurance is so crappy, we need insurance for our insurance.
Oh my goodness.
It's true. So historically, again, this is something that is called supplemental because it was usually given to you by choice if you wanted to add it to your protection through your employer. So it includes accidental insurance, critical illness insurance, and or hospitalization insurance. So the thing is, though, is that once you qualify for you have like a qualifying event, whatever it is that you've chosen, the premium is reasonable and you get a payout that covers all kinds of things that happen when you were sick or hospitalized or injured. You couldn't work, the bills pile up, you get a flat cash payment to cover those things. So it's risk protection, basically protection against financial catastrophe, which is what insurance is for.
Yeah. Oh, that's wonderful advice. Absolutely. So say, for instance, they didn't have any medical insurance and they've now become ill and they're struggling with all these bills. What advice do you have for them? Because I know they're watching and thinking, okay, well, great advice now, but it's a little bit late for me. So yeah, what do you do with all those bills coming in? Because that is just, excruciating.
Most of us in the States kind of tune out about how to pay for things like that because, again, we don't think it's going to happen to us. So usually the folks that are thinking, hey, wait, crush medical debt, they're usually already there. They're usually already panicked. Something has happened. They've had an emergency surgery, an emergency event, like my hospital roommate, Mia, that it was, at a young age. She had two young toddlers. They weren't even in school yet. She's only in her early 30s, and she had a serious medical problem that kept her coming back to the hospital. And her insurance was through her husband, who worked at a 24-hour diner. So clearly very modest income, right? So the thing is, what to do when you're in that situation. There's 100 million Mias in the United States in that situation. So she was actually thinking about leaving the hospital early because she was like, when I was here the last time, I got this huge bill that she was tricked into signing. And she says, I don't think I can afford to get this care. So what do? What did I tell Mia to do? 3 steps. Number 1 is to make sure when you get a bill, that you make sure it is a real bill, an accurate bill. And an accurate bill has what's called CPT codes, CPT. And what you're going to do is, I laugh when I think about it because there is this radio host who says, CPT codes, you know what? I'm going to call that can't pay this. So I laugh, now I laugh every time. I can't
pay this.
stop myself from giggling every time I say it. I hear his voice say, can't pay this.
I can't pay that code.
So CPT codes are to medical services in the United States what barcodes are to products in a retail store. So every medical service that you can think of getting in the United States, every test, every outpatient visit, every ER visit, every operation, any procedure, they all have their unique CPT code. And that's how you can tell what you are paying for. Am I paying for apples or am I paying for cows, right? So first step is to make sure that you get a real bill with CPT codes, that it has someplace there, somewhere on the pages that has CPT or CPT/HCPCS, HCPCS, which is HCPCS is a type of CPT code. Okay. Now, the reason why I have to talk about this, Lorna, in step 1 is because unfortunately 8 to 9 times out of 10, every bill actually, unfortunately, doesn't have CPT codes.
Oh, really?
You're going to call back the provider and you're not going to pay that first bill. I call it the wishing number. And usually in the upper right-hand corner of the first bill you get, usually doesn't have CPT codes on it. And they say, hey, you owe this amount. I call that a wishing number because they're wishing and hoping and praying you'll fall for it.
Yeah.
No.
And a lot of people do, right? Because they're honest.
Real bill.
Right. People are honest. They get these bills. They freak out. They just want to pay. They don't want to be in any trouble. You hear all these stories because there's such fear built up already before you get the bills. So by the time you get them, it's like, oh my gosh, I just have to pay. Yeah. Oh, that's excellent advice.
Our medical system counts on it. Our hospitals, our large medical systems count on that because they know we love our nurses and we appreciate our docs, right? And so they're like, oh my gosh, they saved my life or my loved one's life, and I want to make sure they're paid. No, the doc has nothing to do with the back office, with the folks that make the rules about how it's billed to you and the charges. And if physicians knew what was being billed to their patients in their name or done to their patients in their name, being sent to collections, having their wages garnished, being sued, having liens put on their homes, they would be outraged. But the docs have nothing to do with the billing, the finances. So that's why, we panic and we want to pay it off right away. No, don't do that. They're counting on that. So once you get a real bill, step 2, you're going to Google or now do an AI search is what I do, a chat GPT search for each of those CPT codes, Lorna, to make sure, number 1, you get a description of each of those services to make sure it sounds like the service that you got, to make sure you're not getting upcharged or things like that. If you came into the ER they told you, hey, you have a broken arm, a fractured arm, we're going to put a sling on you and we'll send you to an orthopedic surgeon in a couple of days that's closer to your home. But when you get that bill, Lorna, make sure it doesn't say something like humeral fracture intervention.
Yeah, because we don't know the lingo, right?
Like a sling. That sounds like a lot more than a sling, and it is. So just make sure you're not getting upcharged. And while you're there, find out the most the lowest, most fair retail price that you can get for any medical service in the United States. And that's what Medicare pays for those services. So for each CPT code, find out what Medicare pays for, the Medicare reimbursement rate or the Medicare rate for each of those CPT codes. Then you're going to take that to step 3. That information is step 3. And you're going to say, okay, I total it all up. You're going to call back that number that was in the upper right-hand side. And they said, hey, questions, call our billing office. Yeah, you have questions. I want to talk to them about, why are you sending me this huge number that doesn't make sense? So let's say in our hypothetical example, I like to use a lot, Lorna, is let's say you had to go in for an emergency hernia surgery. And the original bill was $10,000, that fantasy made up number in the upper right-hand corner in that first bill. Let's say that was $10,000. But with doing the 3 steps, you figured out that totaling up the CPT codes, what Medicare pays for all of those is only $3,000.
Oh my goodness.
And it sounds like a huge difference, but it's not. It's really very, very, very common. Really common. And the differences in what Medicare pays for services and what is charged is sometimes 10 times the amount, or a tenth of what's billed. It sounds crazy, but it's true.
So is that the only amount that you legally should be paying?
Exactly. It's the fair retail price, the lowest price that providers accept in the United States for their services. I won't bore you with the details, but there's an argument that many medical centers say, well, if everybody paid Medicare rates, we'd go out of business. No. And there's actually a study a couple of years ago that showed that that's not true. But anyway, that's another story for another day. That has nothing to do. You want to make sure it's one thing if they have like they can afford high-powered financial executives to make sure they stay solvent. You don't. You pay the lowest fair retail price, right?
It's better than losing your home and your family and, everything that goes with that. I agree.
Well, think about this, right? Think about this, Lorna. If in the United States, if medical bills is the number 1 cause of debt and bankruptcy, what's the number 1 cause of divorce? Medical money problems.
Money problems.
Financial problems, financial difficulties. So there's a direct relationship between debt, the number 1 cause of debt in the States, medical bills, and divorce. Destroyed families. So it's a big deal. So that's why you're going to take that number from step 2 that you collected, you added it, totaled what Medicare pays for each of those CPT codes. Step 3, you're going to call back the provider's billing office. You're going to say, hey, that number that you gave me, I know you sent me a bill for 10 grand, but in my case, I am willing and able to pay $3,000. Who can I speak with who can help me make an interest-free payment plan, or just say a payment plan? And when you're talking with them, make sure it's interest-free.
I love it.
Your budget.
Oh, Virgie, you are a lifesaver, and I thank you so much for your time. We are literally at the end of our show, but you are like a powerhouse of information. Thank you so much for joining us today.
Oh my gosh, Lorna, thank you so much for having me. We really appreciate you.
And that is it from us, Woman Power and Lorna Grayling. If you would like to get in touch with Dr. Virgie, her details will be on the screen. Listen to her weekly talk show on The Voice Radio. And until next week, goodbye. Like, share, and subscribe to our YouTube channel to allow us to make more episodes and be inspired and empowered by incredible people.